Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. We're glad you're joining us for this episode of Aging Insights. Today we're going to talk about the disposal of drugs. More than likely, we all have prescriptions that we've stopped using or medications that have passed their expiration date. Our guests today are Angelo Valente, Executive Director of the Partnership for Drug-Free New Jersey, and Dr. Sen from Raritan Bay Medical Center, which is part of Meridian Health. I'm very happy you're here today. We always hear that there are proper ways to do things and improper ways. So Angelo, why don't you tell us what the Partnership for Drug-Free New Jersey is about?
Sure. Well, thank you, Grace, for allowing us to be here today. The Partnership for Drug-Free New Jersey was created 25 years ago, and it was created as a part of the National Partnership for Drug-Free America. And its main goal and mission is to alert the public about the dangers of substance abuse. And over the years, we've seen many trends that have really impacted our state. Over the last few years, prescription drugs have become really our #1 issue that we're dealing with. And that's why this show is so important, talking about the fact that there are so many of these prescription drugs that are sitting in everyone's homes. And really, we have to realize that the reason why we're so involved in this issue is that 70% of people who are in rehabilitation centers as a result of their addiction to prescription drugs, they said that they got those drugs, they accessed those drugs through the medicine cabinets of family and friends. So,
not through their doctor.
No, well, in many cases, the prescriptions obviously came from a prescribed medicines from their doctors. But so many young people were experimenting with these prescription drugs because they felt that they were safe. Since they were prescribed by a doctor, since they were being taken by their grandparents or parents, but how dangerous could it be? And we've learned that in many cases, especially when you're dealing with the opiates, that they can become extremely addictive. And that's why this effort is so important. First and foremost, to alert people about this addiction that exists and this epidemic. We're at epidemic levels in New Jersey and throughout the country. But secondly, to be able to tell them that there's things that they can do to help prevent this particular substance abuse issue from happening in their families. And one of the ways is to be able to eliminate, to dispose of safely the medicines that you have in your medicine cabinet that you no longer need or want.
Yeah, I appreciate you mentioning that. Your name implies you have a lot of partners. So who would that include?
Well, we work with government. We work with the nonprofit sector, other folks that are involved in prevention and treatment. We work with the media because it's crucial for us to get the messages out, so we have a lot of partners in the media. And over the last several years dealing with this issue of prescription drugs, we've also worked very closely with the medical community because we believe that they are really a great partner in helping to identify the issue in their patients, being able to safely prescribe when necessary, but also being able to share information to their patients about the dangers of these drugs.
I noticed on your website that you talk about the American Medicine Chest Challenge.
Yes.
Can you explain what that is?
Sure. The American Medicine Chest Challenge was actually created in New Jersey as a national initiative.
Really?
And what we found was that several years ago, prior to the Federal Drug Enforcement Administration being involved in this issue, there was really very few opportunities for residents of New Jersey and residents throughout the country to safely dispose of their medicine. It was very confusing. The guidelines, if you looked online, were really you had to have a law degree to be able to figure out what you could or could not dispose and how you could dispose of those medicines. So what we did in New Jersey is we worked with our local Drug Enforcement Administration, and we established the first ever Take Back Day. And that was a partnership between law enforcement and the Partnership for Drug-Free New Jersey. And what we did is we worked so that all of the communities throughout the state would have an opportunity to go to their local, either a police department or sheriff's office or New Jersey State Police as well were involved. And what they were able to do during a certain period of time was to bring their unused and expired medicines to the police department, and then they would be safely disposed of through incineration, which is a very both cost-effective way, and also it's a great way from an environmental perspective to be able to dispose of these medicines safely. And the event was very successful.
New Jersey was the first.
New Jersey, we were the first state in the nation to have this event, and it really became the model for the rest of the country. So as a result of the success we had, the White House Office of National Drug Control Policy featured this particular event back in 2010 as a model project. And we received calls as a result of that from folks throughout the country that wanted to replicate what we had done in New Jersey. So what we did is we created the American Medicine Chest Challenge right here in the state to be able to really make it a turnkey process for other states, other communities to be able to replicate. Now that has evolved quickly.
I'm sure.
And what we've seen, what we're seeing now is that in many communities, not only do they have the temporary day, which you'll have usually in the fall or the spring, but you also have permanent collection boxes, which are boxes that are located at police departments where you can go anytime to dispose of your medicine. And that's particularly important in end-of-life situations where you have family members that might walk into a home and there would be, numerous prescriptions, most of which would be opiates. And it's important to be able to know where you can dispose of that medicine safely.
Sure.
And so what we do with the American Medicine Chest Challenge is we have a directory which you can either visit our website, which is the AmericanMedicineChest.com, or we even have an app, a free app, where you can download to your phone. And if you put your zip code in, it will tell you within a 5-mile or 10-mile radius which police departments are participating on a permanent basis.
Now, is this just a New Jersey directory?
No, it's a national directory.
National
Yes. We have about 240 locations in the state of New Jersey.
That's great.
Police departments, but there are close to 2,000 locations in 47 states that are registered with the American Medicine Chest Challenge.
Well, I think that's important to know. People travel, people have other family members in other states, people are distant caregivers, so it's nice to know that they can find such an important resource.
Yes,
So
and it's
that's
all
great.
free of charge, and there's no questions asked. So when you do go to the local police department, you could bring your medicines in a plastic bag, or if you do keep them in your prescription bottles and you want to dispose of them, it's important to make sure that you cross out any information. So there's confidentiality. So any names or prescription doctors' names on those bottles should be blacked out in marker or whatever.
Right, a marker. Or I guess sometimes you can pull out the labels, but they're pretty tight.
Yeah.
They're pretty tight. So we understand there's a 5-step American Medicine Chest Challenge.
Yes.
Is that different than what you just described?
It's part of that effort because not everybody has medicines that they need to dispose of, but those folks are just as that their families can access those medicines as quickly as those who have medicines that are not being used. So if you have medicines in your medicine cabinet that you use on a regular basis, they're the same kind of concern should be shared for those individuals as well.
Do we want to give an example? I'm just
Sure.
curious.
Well, you might have an individual that might be on a pain medication for a post-operative care, and they have a 60 or 90-day supply. And they're going to be using that medication for 60 or 90 days. So when we talk about disposing of those medicines, they might not be interested because they know that they're going to be using those medicines and it's not going to affect them. But those same medicines could easily be accessed in their medicine cabinet by grandchildren, by folks visiting. So it's not only people who have to dispose of their medicines, but anyone who has medicines in their medicine cabinet. If they take these 5 steps, one of which is disposal, but the other steps are just as important. First and foremost, you have to know what's in your medicine cabinet.
True.
Do an inventory. I mean, so many of us, before I was so involved in this program, when I went during the first take-back day and I looked at our medicine cabinet, I couldn't believe there were medicines that were sitting there for 5, 10 years that we might have taken 1 or 2 after a dental procedure, and then it just sat there. So that's the kind of medicine that becomes very concerning for access by children, by other even adults that have an addiction problem. The second step is to make sure you keep your medicines in a safe place. Now, this is contrary in many ways to what we've heard for many years.
Not on the side of your bed?
Well, we heard putting it in the kitchen so you don't forget to take it.
Exactly, that's what I mean.
You know, making it visible. And it's important to remember to take your medicines because medicines play an important role in keeping our folks healthy and living active lifestyles. But we've seen a change in that process. Now we're asking people to keep them in a safe place, out of the reach of children, out of the reach of folks visiting, out of the reach of a worker that might be coming to your house to fix a leaky pipe. Because those are the kind of individuals that might wind up in your medicine cabinet if they have an addiction issue with opiates. So it's important to keep them in a safe place. The third step is to make sure that you don't share your medicines. Medicines are prescribed, and the doctor will talk about it a little later, with an understanding of a patient's physical and mental care. So it's important that medicine's not shared, because medicine that might be prescribed for one person might not be prescribed for another person based on other circumstances. And the fifth step, which is most important, is to speak to your children about this issue. Let them know that these are very dangerous, to experiment with these kind of medicines, that while they have a very important role, they also can be addictive. And we need to understand that.
I guess we also have to understand, besides addiction, that there's a street value for some of these drugs, so it may not be somebody using them, but taking them to the next level of distributing to someone else who might use them.
There is definitely an illicit market that exists in the state, and unfortunately we see this in all communities, and that's very important. For many years there was, especially when you're dealing with prescription drugs and heroin abuse, there might have been a misperception about this drug being an urban drug, that you hear about the addicted individual and you think about it, the Bowery for many years, that was a place where there was a congregation of folks that unfortunately had this disease. But now what we're seeing is that these addictions are in each of our communities, our suburban communities, our rural communities, our wealthy communities, and our poor communities. So there's not a family in the state that doesn't need to be aware of this issue.
Sure. So since we really want to talk about the best ways people can dispose of their drugs, and people used to, or maybe they still do, think they can flush. So there's some problems with that, right?
Well, what we suggest is that there's many other alternatives that are safe and that we believe are much more environmentally pleasable at this point. One, and first and foremost, we recommend, if you have an opportunity, to go to a local police department that is participating.
One of the 240
exactly,
in New Jersey,
is to take advantage of that. And then if you can't, if your community doesn't have one, then in most cases, those other communities throughout the state will have a collection day that takes place usually in the fall and the spring. The American Medicine Chest Challenge has a collection day in November each year, the second Saturday in November throughout the country, which includes the New Jersey communities. But if you can't get to a collection site for any reason, there are some other safe ways to dispose of your medicines. The recommendation is that you take those medicines and you put them in a plastic bag and you dilute it with water. And then the next...
Is this for capsules, for tabs, for any type of...
Any medicine whatsoever can go in that plastic bag. And then what you want to do is, for safety purposes, you want to be able to mix that with coffee grinds or with cat litter. And then it becomes a solid, and then you can toss that plastic bag into your garbage. So it's a couple of steps, very simple, but it's a safe way to dispose of your medicines from the home as well.
Well, I think that's a good suggestion.
Yes.
And coffee grinds or kitty litter
or
something like that. That's very interesting. And then you just seal the bag and throw it in your garbage.
Absolutely, yes.
Is this true for most drugs, all drugs?
I don't think there's any distinction between the drugs that can be disposed in that respect. So anybody who has any drugs whatsoever can take that process and be able to safely dispose of their medicines from their homes as well.
Well, it's good to know they're not different protocols. It would make it probably more difficult for people. And our seniors who are, I think you've already addressed this, but I wanted to just go back to it again. Are seniors that are not doing this putting themselves at risk?
Well, we think that they're putting themselves at risk, but more importantly, they might be putting their grandchildren at risk. For those that might be experimenting, they might be putting individuals that are visiting them who might have either an addiction disease that requires them to be able to get access to these drugs, or they might be taking the drugs, as you mentioned, and selling those drugs. So I think that, generally it's for seniors that have these medications in their homes, and we know that most seniors have a certain number of medications in their homes. I know research has shown that when a person reaches a certain age,
Right.
there's anywhere between 3 and 5 medicines that they are taking at any given time.
Right.
So we think it's crucial for them to help protect themselves and their families to be able to take these steps.
Well, I think it's good to tell someone how they can do it themselves in an easy way.
Yes.
Now, Dr. Sen, I know you and I have spoken off camera about pain relief when people are having surgery. I mean, opiates seem to be the most frequently prescribed medication after knee or hip or surgery or whatever, the pain management for rehab. But often I hear patients who don't want to take those medicines for a variety of reasons. So how does, shall I say, not electing some pain medication affect their rehab, or doesn't it?
Well, rehabilitation is a very comprehensive concept.
Okay.
It's a very big concept, and taking away the pain is one component, which is not to disregard pain. But pain needs to be approached both objectively as well as subjectively. So pain relief comes through the body, pain relief also comes through the pain. Now, we have to understand one fundamental concept about rehabilitation. Rehab will take care of the immediate problems. It gives an immediate relief and a benefit. But rehab is also about giving a long-term benefit. The rehabilitation
right, I was going to say building back that strength that you had
building
before.
back the strength.
Okay.
So it has to be a marriage between the immediate effects as also the long-term benefits. So in the concept of pain relief, it does not really make any sense in giving a pain medication which can take off the pain, but at the same time in the long term it can introduce addiction, it can give a whole lot of adverse effects. Now coming back to drugs, any drug would have its own adverse effects, all right? And if you use it for a chronic period of time, you're going to have its adverse effects. If you overdose it, you're going to have its adverse effects.
Sure.
So no drug is an angel in the sky. But when it comes to this class of medication,
Opiates.
it is beyond this drug because it is about addiction, it is about tolerance, which kind of piles up. So to that end, when we look into this epidemic that we are having here, I call it an endemic also because it has become a culture, I would welcome this apprehension. The fear that we have. I would call it a very necessary awareness that this is a medication which can take off the pain, but this is a medication whose consequences are far more adverse than what we can imagine.
So before we go further, can you list the common opiates? We talked a little bit, because sometimes people don't realize that they're taking an opiate. It was prescribed to me, it's Percocet. Is it a problem? So what are some common brand or generic?
The adverse effects of...
No, the names of the actual drugs.
Well, OxyContin is one of them.
OxyContin, okay.
Percocet is another one. Vicodin is another one. Vicodin, we use it. So it comes in different brand names.
Okay.
And again, the adverse effects are very strong.
Sure, that people don't want to be foggy because they think it's going to make them foggy, or so there are a lot of other side effects. So what are some others?
Yes, feeling foggy is only the tip of an iceberg.
Tip of the iceberg. Okay.
There's something which is called as respiratory depression.
Okay.
It
so
depresses our respiration. And I would like to add one point here. There's a disease that is very common, much more common than we think, and it goes vastly underdiagnosed. It's called sleep apnea.
Oh.
Now, in sleep apnea, the brain does not give the right signals for the lungs to breathe. So we have episodes of no breathing. We call it apnea. So anyone who is with sleep apnea and is on these medications, you're looking at a disaster that's waiting to happen. Because one of the most prominent adverse effects of this class of drugs, opiates, is respiratory depression. That's one.
Okay.
The other one is constipation.
Okay.
By nature, this class of medication decreases what we call the peristaltic movement of the gut. I have had patients who have come to us with a bowel obstruction. So in other words, he started out with a constipation, they wanted to get rid of it, they took another set of medications, and it didn't work because they continued to take this class of medications and ended up with a surgical emergency.
Right. So, so they have a bowel obstruction, which is a side effect of, well, constipation that's built on with a bowel obstruction because of the side effects of the opiates.
Absolutely.
Okay. And now you even see advertisements for those on LindenTV, which is not how to get a bowel obstruction, but how to take a medication to deal with it. So I'm just curious. So I just want to go back for a second, because as I said, I think people don't necessarily understand their medications are opiates. Tramadol, is that one? OxyContin that you talked about, Percocet,
Vicodin,
okay.
Ultracet.
Okay. And, okay. So I just want people to be able to say, oh, I am taking, yeah, now I recognize an issue that I might have. Okay. All right. So are there alternatives regarding pain modification that would help someone sidestep using an opiate?
Absolutely. There are plenty of them. First of all, we have medications which are non-opiates. They are strong, good analgesics. They work just as good, analgesics. Okay. They work just as good as these class of medications without the adverse effects. Acetaminophen is one of them.
Acetaminophen,
yes,
okay.
They work very well. Non-steroidal anti-inflammatory drugs, they also do a good job. We were talking about Motrin before that. They also do a good job. We have to realize that 80 to 90% of the global consumption of opiates takes place in this country.
In the U.S.
In the U.S. So there is something fundamentally wrong that we are doing when we approach this pain, this concept of pain. And besides the pain medications that we have, there are other ways that we can approach pain relief. One of them is CBT, what we call as the cognitive behavioral therapy.
Cognitive
behavioral therapy.
Okay.
They kind of tutor the mind to control their own bodily pain. Now, these are very well-structured, well-focused, well-directed therapy sessions. They work very well.
So with that, you would need the help of a therapist, presumably, and it would take, I would imagine, a couple of sessions to
sessions.
But it would be also, we talk about long-term effects. Presumably, it would help you in other instances, too.
Absolutely.
So,
and with it comes the obvious benefit that they don't have an adverse effect.
Of the opiates.
Of opiates. And then, which comes very close to the CBT, is meditation. And there have been tons of literature coming out from evidence-based trials and research that has been done in prestigious Ivy League universities here, which has shown that meditation plays a big role in reducing this the feeling of pain. So there is no point in keeping them as intellectual treasures.
I was going to say secrets.
Secrets, and not use it
right.
When the situation comes in pragmatic situations. So we got to bring those concepts here and utilize them.
And how do we do that?
Well, I think we got to change the mindset of physicians
and patients.
And patients. Each of them, they need to be convinced that these other avenues are just as good, if not better, than these medications. We have a dependency on medications that needs to be addressed very seriously.
Right. But compliance with those medications is important.
Is equally important. Yes.
Right. So
absolutely.
Whether it's limiting it or whether it's using it as needed, I mean, I don't know.
I think another issue which is crucial is the long-term use of opiates, and I think the doctor might be able to share how that whole community, the medical community, is changing their position, because for many years people were kept on opiates for extended periods of times, 3, 5, 10 years.
Right.
And there is a point where the opiates can only provide so much relief.
Oh, so you have to build
you build up, but also there is a point where it turns from a relief of pain to an addiction. And that happens all too often in patients that are on long-term opiate use. So I think that's
that's a perfect point raised. What we call as tolerance.
Tolerance.
Opiates have tremendous amount of tolerance problem. You start out with one medication, they give the desired effect, then 1 week down the road, 2 weeks down the road, you will need about 2 to 3 of them for the same desired effect. And in the meantime, you develop this addiction.
So going back to, shall I say, advocating for a new perspective, I know you train new doctors.
Right.
So is compliance, proper drug disposal, and alternatives something that you're able to cover in that training?
Absolutely. There are 2 venues where it provides us with a great opportunity to train our residents. One is the post-op. When the surgery has just been done, the patient gets downgraded to the floor. So there is an opportunity to train the residents to apprise the patients that, you've been on morphine, justifiably because of the acute pain. Now you're going to go home, but these are medications that if it needs to be taken, it needs to be taken for a very short period of time because of its adverse effects and its capability to introduce addiction, as also the fact that there are other alternatives which are just as good.
And you teach the residents how to speak to patients?
Absolutely. It's one of the core competencies. You know, in residency across the board in this country, we have 6 competencies, you know, patient care, medical knowledge, patient-based learning. So one of them is professionalism and communication. So these are very sensitive situations. We actually train them to take their time, sit with the patients, reach out to the patient's problems, and give them the viable alternatives.
And what about our current core of physicians?
Well, there's a very interesting bill that's in Trenton that both the doctor and I have had an opportunity to speak to the legislators about. And this bill would require that physicians, prior to prescribing an opiate, be mandated to have a discussion with the patient, or if it's a minor, with their parents, and also discuss the alternatives that the doctor was speaking of. So that is really a very innovative approach. We're very pleased with the support we have received. That bill passed the Senate almost unanimously in New Jersey, and now we're waiting for it to be voted upon in the Assembly and then signed into law. But that bill would be setting a gold standard in New Jersey for having this conversation between a patient and a doctor about the concerns and dangers that may potentially exist with the prescribing of an opiate, and also what alternatives might be available.
And does this enable continuing education for those physicians that we currently have?
Yes.
Absolutely, absolutely. One of them is, you know, every institution, they have an approach to continue these medications.
You mean hospital practice, medical practice?
We have seminars, we have workshops, we have grand rounds, and we actually invited Angelo to speak to us. And, you know, the knowledge gets, you know, distributed to the other medical staff. But I also think this is such a global, national problem. It has to come from all corners. It has to come from us physicians, from hospitals, great organizations like this one, from the media, from foundations, from legislation. So all of us, we need to shake hands and put an end to this epidemic.
But we do think that there's no question that there needs to be some sort of standards for continuing in medical education requirements for all doctors that are prescribing opiates, which we are also working with the legislators in New Jersey to be able to establish. So that's another very important aspect, as the doctor had mentioned, is that continuing education on the part of the physicians about this issue. Because for many years, I think physicians were led down a path of believing that opiates were a quick fix, and that there were very little negative aspects to it.
So it's good to know there are alternatives, and that, in fact, if you have these in your home, that you can figure out the best way to dispose of them.
Yes.
So I'd like to thank you both for sharing your time with us today. It's a very important topic. Aging Insights is produced by the New Jersey Foundation for Aging and is made possible by donations to the foundation. To become a sponsor for Aging Insights, please go to our website at www.njfoundationforaging.org, or you can call our office, which might be easier, at 609-421-0206. All of the previous shows that we've done can be viewed on our website. We want to remind you to find out about senior services in your area. Please contact the county offices on aging, and you will see their numbers on our website, and you may go to the state hotline at 1-877-222-3737. And I think we'll put your number on our website too, so they can find out about disposal. Thank you very much for watching this episode of Aging Insights. And remember, aging is everyone's business.